Hello, everybody. I hope you have seen the first part of this video, which is about emotionally unstable personality disorder or borderline personality disorder. I'm doing this series of videos for people who are new to this diagnosis, families of people who have been given this diagnosis, and in case you have old diagnosis, and I'm hoping some of the information that I have that I'm sharing with you can enhance your knowledge. If you've seen the first video, then you know most of the information that I'm going to speak in the next few minutes. But if you haven't, this is about appreciating that a mental health diagnosis exists that is responsible for frequent mood variations, intrusive thoughts of self-harm, somebody who lives in the fear of being abandoned and left alone, somebody who struggles with chronic feelings of emptiness. They are less able to control their impulses, hence end up taking drugs or alcohol, inappropriate connections, or self-harm. Some of them seems like destructive behavior that's driven by themselves, but what's true and is important for everybody to appreciate is that they don't have a choice in the way they're feeling. Under pressure, people with emotionally unstable personality disorder can dissociate. That episode can be full of paranoia. They're feeling that they are being watched or somebody is planning and plotting against them. They can start hearing voices that are not real, but for that duration, for them, it is real. Their relationships, something that makes us all feel very safe and comfortable, go through ups and downs because they move from loving somebody too much to hating them very quickly without having any control over them. Of the many reasons that I'm doing this talk is so that I can raise awareness in people that this disorder, though considered by many health professionals that people who struggle with this end up meeting in emergency services, do not believe in or believe that a lot of times people have a choice. Emotionally unstable personality disorder is a form of mental health diagnosis according to ICD-10, 11, and in DSM-5. By definition, if you have a diagnosis, that means you do not have a choice on the symptoms of that diagnosis. Ongoing difficulties in managing internal emotional chaos, internal feelings, are a burden that continues to cause their morbidity for the rest of their lives. It is very difficult to imagine, if you do not have this diagnosis, what it feels like being afraid all the time of being abandoned. It is very difficult to imagine what being anxious and depressed all the time since they became 16, 17, 18 feels like. In my view, it is almost impossible to put ourselves in the shoes of somebody who has this extremely complex diagnosis. And then it is completely unfair not to believe in that diagnosis. It is beyond the realms of my imagination to feel what an intrusive self-harm thought would be, because I've never had it. I cannot personally imagine, and I am sure a lot of people who don't have this diagnosis can imagine what it feels like to live with doubt of the inner core of somebody with Eupd. All of us have words and definitions of who we are. I am so and so, I'm a male, I'm a female, I'm a brother, I'm a father, I'm a husband, sometimes their behaviors, their engagement can make the relationships very fractious. Lots of fights, lots of ups and downs. The mood swings does not help. Their black and white thinking, they're swinging from adoring somebody to hating somebody and then adoring somebody does not help. The relationships, something that they crave, something that they want to do, are difficult for them to maintain, for them to keep. So they keep missing this anchor we who do not have this diagnosis have when we have ups and downs, thereby adding to their burden. When somebody lives with anxiety, depression, not knowing who they are, with intrusive thoughts, impulsive behavior, engaging in alcohol and drugs, developing eating disorders, self mutilating behavior, that can be explained because of this ongoing difficulty. The difficulties and challenges caused in their life is phenomenal. They are always at risk of fatally harming themselves. There are many ways to describe the difficulties that they have, but one of the ways is to break down their symptoms into four broad categories. So the first one is affective instability or emotional instability or mood variations. It's mostly a psychological phenomenon, but their moods can swing from one end to another without any reason, many times a day, or lasting at one end for a few hours to half a day. The technical term is affective dysregulation. The second main area under which we can describe the symptoms is cognitive distortions or disturbed patterns of thinking or perception or perceptual distortions where they cannot help but think in certain patterns that they are aware are not helpful. The third subcategory of symptoms describes impulsive behaviors. Alcohol, drugs, self-harming come under this. And the final category is intense but unstable relationships with others. I will go through each of this subheading and describe some of the symptoms that present themselves because of these four categories. This is not a comprehensive list. People have presented with symptoms over and above this list, but I am aware that almost all these can be fit in some of the criteria can be some of the symptoms can be fit in either of these four boxes. Let's talk about the first one. Emotional instability. Now all of us have moods. All of us have ups and downs of moods. However, the severity of our ups and downs for people who do not have this diagnosis is very different to somebody who does have this diagnosis. Everybody, all of us, can get angry. However, people with Eupd can suffer with rage. All of us have felt bad, embarrassed in the past now, but they can feel extreme shame, extreme sorrow. People who do not have this diagnosis suffer with some anxiety symptoms like anxious thought process, panic attacks, worrying. However, they suffer with extreme panic attacks, extreme anxiety, sort of hyper-arousal, restlessness, agitation, all the time. All of us, sometime in life, might have felt a little disengaged with feelings of emptiness. However, this is something that we are able to overcome. However, people with this diagnosis suffer with feelings of emptiness, loneliness, all the time. Combine this with severe mood variations that I'll talk, it can make them feel suicidal, despair. It is difficult to keep a positive outlook in life when somebody is carrying so much burden. The funny thing is, a few hours later, they'll be well because the moods change, the moods swung, and they do not have control over this change, thereby creating complete loss of control, no anchor in their day-to-day living. It can change from morning to evening, it can change a couple of few days, a couple of weeks. But these mood swings cause a significant amount of burden on their shoulders of mental illness. And because they don't control it, it is not predictable, so they themselves do not know what's going to happen. The second big box that I talked about was disturbed pattern of thinking. This causes lots of problems. They can be the harbinger of depression, anxiety. They can also be responsible for the relationship challenges that they go through. It's extremely important to remember that they do not have a choice on what kind of thoughts they get. They can get, for example, upsetting thoughts or feeling that they are terrible, horrible people. Or they can get thoughts that they don't exist. They might not be sure of their own body image, of who they are inside, hence everything is based on external feedback, and in case they do not get it, they struggle to see where they lie or who they are. This might lead to their asking frequent reassurance. And sometimes they can struggle to even believe that reassurance because the inner self is so fractured, it's so traumatized. And of course, when they are put under pressure, they can have a dissociative episode when they cannot differentiate between what's real and what's not. They can start hearing voices, they can start feeling paranoid. They can have different perceptual experiences. Even sometimes talking to them, they might be affected emotionally. They can be described as overtly sensitive people to feedback. I recently saw a client who regretfully, when dissociates, hears voices which command her to harm herself. Of course, she goes to a significant distance to avoid being stressed so as not to dissociate. But our lives are complex. When she dissociates, the auditory hallucinations are associated with some perceptual hallucinations as well, so she can feel things crawling on skin. She's unable to differentiate at that time whether the voices are coming from outside or inside. Nevertheless, under stress, when she decompensates, the risk that she presents to herself is quite high. It's important to realize, it's important to remember that this is not something she has control over. It's important to remember when dealing with somebody who has EUPD is that nobody has any control over their symptoms. So, for example, when somebody dissociates and they become psychotic and they might be feeling that their family members are against them or planning and plotting against them, this is a sign of illness. This is not who they are. And I appreciate that sometimes Family members keeping it together can be difficult. Keeping it together is a challenge, but it is important to remember this is not what they want to say or want to do. They have no choice because it's part of illness. The third category of symptoms are impulsive behaviors. It's a lot like ADHD in adulthood, but a little subtle difference. People with borderline personality disorder get these impulses in their head. It could be anything. They have no control over those impulses. What's also true is they have less control over not responding to those impulses. Mostly there are two kinds of impulses. One of them is an impulse to self-harm, so cutting self. Majority of my clients report that cutting makes them feel better. There is an increase in anxiety, restlessness within themselves that slowly increases. And when they cut themselves with razors, burn their skin, they feel as if this mountain of anxieties have settled down. This wave of inner discomfort has calmed down for some time. This is backed by science because whenever we cut ourselves or something else cuts us, endorphins are released, which which does reduce some of the pain that we are feeling. The other kind of impulses that people with EUPD get is an impulse to engage in a reckless, irresponsible activity. Binge eating, or drinking too much, or taking drugs, all are part of that impulsive pattern, which starts with I can do anything or I don't care what happens with me. I have seen people go on a gambling spree or spend too much money that they do not have unprotected sex. And on reflection, these are very sensible people who would never do these actions, but during that moment when they get those impulses, they are unable to control them. They almost have to police their behavior and their thoughts all the time, though they are less able than somebody who does not have the diagnosis. A lot of us find the anchor, the learning of what is right and what's wrong from the relationships that we have. People with emotionally unstable personality disorder regretfully have a pattern of unstable relationships. It could well be because they live in the fear of being abandoned. Hence, when they find somebody, they have a significant effort going into that relationship. They're very intense. As a matter of fact, partners of people with EUPD have described it was almost like they feel smothered. However, because they're living in the fear of being abandoned, anything that their partner says or does that evokes or triggers that fear, makes them very anxious. They can move from being very engaged, loving, to completely hating. The intense anxiety, the impulsive behavior, the anger drives this swing from loving somebody to hating somebody to loving somebody many times a day. So they could start a relationship with significant emotional investment by constantly texting, phoning, calling that person in the middle of night, by multiple gifts, physically clinging onto their partners because of the fear that they will be left alone, refusing to let them go at work, for example. However, the fear of being left alone still continues to dictate their behaviors. It still continues to drive their inner emotional chaos. They can then threaten to self-harm or mutilate themselves. Majority of people with this diagnosis are a risk to themselves rather than anybody else. However, their way of expressing that anxiety can have serious and negative consequences. The intense fear and the anger that these people live with causes significant challenges in relationships. And family members, partners, friends, or people with EUPD can feel confused because they are unable to predict what that person will do. The challenge here is appreciating that the patient themselves are unable to predict. It's not a choice. They can go from being very warm to emotionally rejecting for no reason at all. There are many other ways of looking at emotionally unstable personality disorder, but we know that it doesn't matter what boxes we create to put the symptoms in. Going from one end to another, having black and white thinking, fractured relationships, self-harm ideation, fear of abandonment, causes significant challenges. Self-harm is the biggest reason why they present themselves to A&E. And I'm hoping that this video is one way where I'm able to engage and evoke empathy for this diagnosis. For people to understand and remember that nobody chooses to carry this much burden. And it might well come across that people with EUPD have a choice. In my experience, I have felt that they don't. Nobody makes a choice of carrying that much burden. And not being heard with empathy in crisis, not having your feelings validated when they are playing havoc in their life. Getting feedback to say somebody can choose not to self-harm, I feel creates more barriers and reduces the resources available for people who have so much pain. I hope this part 2 of EUPD talk has been helpful. Please share this with people who you feel might benefit from it. I will endeavor to do the third version of the talk where I will talk about some treatment issues and what can be done to help people with EUPD. Thank you for your time. I wish you all the best.